Okay, so this is the documentation. You know, we're planning to upload to for the 5ire Hackathon in the phase one. So which is the idea phase. So
Hmm.
submitting the idea. If we get selected in the phase two, there will be implementation phase, and I think phase three. Let us quickly look if there is mentioned anything about phase three. Shortlisted announcements, submit project. Where are the given phases? So all these people, they want to join my team, but I do not know how to reach them. There's no messaging. So there's a Slack community now. So
Okay.
if you want to, I do not know whether you can join directly, but you can find this on my link also. I'm part of the developer community for this hackathon also, and one can message basically each other in that. Like you can create teams, and it's like a
Hmm.
WhatsApp tool, Slack tool.
Okay.
So there I could not find all any of these people, and so that's why I could not. If I cannot communicate, there's no point in having them on the team. Right? There has to be some communication channels. So I don't think they are aware about Slack community. Even I was not aware. I was sent a mail today, email yesterday that special email saying please join Slack. So that's how I came to know, okay, this messaging tool is there, maybe that we can use to communicate. So,
Okay.
so this is the idea submission, and so I've given the objective over here. I've already attached one version one, but I think I need to upload. Oh, can I upload? Am I logged in? Edit. I can edit this and I can upload the document again then. Version 2.
Okay.
But is it submitted? Yeah, I've not submitted, no, so I can upload the file again. So it says the objective is to make the healthcare data available via blockchain technology to all relevant stakeholders, especially between physician and patient over the entire lifetime across any location. So in the world of inequality, a lot of people do not have access to healthcare, and even if they do have, a history of healthcare data is not available for the physicians and relevant stakeholders to look at. We are looking for an innovative way to resolve this solution using blockchain technology. How we plan to build this idea? We intend to use 5ire, Substrate, Monstack, AWS platform, etc. to achieve the same as needed. We hope to deliver the prototype solution to UN and all the governments of the world through various competitions. We may adopt the idea to run the consortium or a public blockchain platform for the greater good of all global citizens. And then we have proposal document which is attached, and so I have kind of modified. But so the name of the app is name of the entire application, we're calling it as Swastha. Okay, so Swastha means
Okay.
good health, right? How is the Swastha, kaise hai Swastha,
Hmm.
see. So that is where the word is coming from, the the health. So since this is a health related application that we're building, so I've named the app as Swastha. So we want to add some names over here. And so there are three parts of the document. In the first part, I'm just briefing a summary. So explain clearly in simple English what is this idea about. So it is the availability of electronic health record for any person via blockchain. So if you have any questions while I'm reading, let me know. Okay, I'm assuming you're understanding whatever we have. I'm reading out. So four actors
Yes, sir.
in the system: physician, medical center. Actually, these are two different actors. Um, we should say medical center who produce the health record, and patient for whom the producer and the physician who will review the electronic health record of patient. And then there is a researcher who researches and innovates using electronic health record data. So there's a researcher in the world who wants to look at all the data he can get into this blockchain and research all the data. For that, the permissions have to be given by the patient to for their data to be shared. In the same way, government can monitor the progress for the looking at this data spanning across the nation, and make some good decisions. And one can have machine learning tools or BI tools around this data to come up with good analysis and good decisions as to how we should proceed forward by looking at the progress of the different indicators. So what features we want to build? So we want to build a front end, a mobile app for patient, physician, so researcher, government. So whoever is interacting, with the system, we want to give them a mobile app through which electronic health records can be fetched or stored, etc. And then we have a backend system which is like your global database, which is a backend blockchain system where records are stored and fetched.
Yes, sir.
And then what are the features that are good to have? So there are many features which we can add to the system. So the system can be, right now the system we're thinking of electronic health record only for human beings, but I think the same system can be extended to support electronic health record even for the checking of the health of birds, animals, fishes that are tracked by people. So there are a lot of health centers specifically for a particular type of animals or animals or birds, where they try to track the bird or they try to track the fish like sharks and dolphins, and they want to monitor their health. And so if anyone wants to know the what has happened with his fish, and one physician has been working on that, let's say that physician is no longer there, now that fish is, if they have that ID of that fish, then definitely it can be tracked through the blockchain. So that is why the system can not only be supported for humans but also for birds, animals and fishes. So the other thing what we can have good in the system is using a portable blood test analyzer. So right now, if you when you go to this any medical center, they have a manual blood testing. They'll take your blood and then they'll say come after 3 days, and then you go back again, then you get the report and you go to the physician. So there is a lot of manual process involved in the initial phase of collecting the blood and performing the test, and telling how the blood, trying to come up with a report which is telling which gives you an indication about different health indicators. So the different health indicators can be what is your WBC count, what is your RBC count, or how does your hemoglobin look like, or sometimes it may not be a blood test, it may be a simple test done by the doctor, and he wants to tell you what is your your blood sugar, or what is your blood pressure, you know and different indicators can be provided by different medical professionals and centers. So but in at a very high level, these are just indicators and they have some value and they have some units. So there can be, we can say WBC is 12 count, so maybe pressure is counted in whatever units, so that unit will be so it's just like saying weight of this, we are calculating the weight in, if it is weight then the unit is kg, you know if it is. So in the same way, in the medical world also, whatever we are measuring, it will always have a unit. So every indicator has a name, has a which the category of the indicator, and the value of the indicator, and the unit of the indicators. So ideally, if you have a portable blood test analyzer, so it is like a automated machine. So you just go there, that machine will take your blood, will produce the result quickly. And ideally we want this kind of portable system to be connected through the network directly to a blockchain, which means the data goes directly into the blockchain. Then some that kind of automation is there, then we save a lot of time, and the records are automatically put in the blockchain once it is automatically collected over here. All these steps can be done manually also, but the idea is whatever data we are collecting at this point, whatever is produced has to be entered into the blockchain. So blockchain is like your database. Okay, so whatever data has been pulled in or entered in, it has to be tracked in blockchain. Then the 5ire interface, basically 5ire is an interface to the the backend system called Substrate. So 5ire is like your front end door through which you can call all the Substrate functionalities. So in this we can right now 5ire has its own set of you can say algorithms to support donations, or different things that they want to support support people or nodes that are contributing towards a UN sustainability goal. So whichever node is participating in, or whichever computer is hosting this our application, they can get incentives based on the reputation scores. Some node is doing very well and has been helping out with all the medical reports and everything. They can automatically the 5ire we can have a we can create a reputation score for that particular nodes, and that can be built in 5ire. Even donations can be supported in 5ire. So there are a lot of some other things that they want to track is the sustainability goals. Which sustainability goal are we trying to target, and what is the reputation score of every node? Which nodes we should donate, or so those are the kind of things we can create an incentive model around 5ire. Other thing that we can have in the system is we can have a token or a crypto of our own. So some token, so every time so either if there is any transaction happening in terms of financial transaction, we can have our own crypto embedded into this blockchain, or we can generate some NFT tokens. So NFT tokens are some digital record. They are not like digital money. So crypto is digital money, but token is a unique digital record. So those records, every time some record has been created, we can create a token around it, and that tokens can be used to as points, or to generate points, or to gift somebody if they are participating in the system. So so that thing is so all these features are still open. It's not like part of the scope, but it's something that it is good to have. Then the pricing model. So whatever transaction. So when we say transaction in this system, it is means a medical report. That is a scope, and but the pricing around it. Let's say medical center is creating the report. Then they want to charge a fee. Then the doctor evaluates the medical report, he wants to charge a fee. So there is no pricing model around embedded, right? It's not part of the scope of the project for us, at least in this phase, to include. But pricing model can be integrated into the system, so that all pricing and the financial transactions that happen from let's say from the patient to the medical center, they pay something to the medical center. The medicals, then the patient pays to the doctor, the researcher pays to the patient, the government pays to the patient. all this pricing can be automatically be embedded within as a pricing application within this blockchain application. So that is what the pricing model means over here. So the donation model is another thing that we can have around this transaction. So donation, it says donation model to support people who cannot afford the medical transaction can be defined around this transaction. So here the first thing is, let's say a person does not have money to pay the medical report, is a poor person, but somebody can donate the money to this person for this particular transaction, like pay for the medical report, or the donation can be right now a scope of the project is for medical reports, but medical report is just one type of medical procedure. The other type of things that happen in medical world is operation, hospitalization, insurance. There are so many things involved, not insurance you can say, but at least hospitalization where the patient has to pay the money and the patient cannot pay the money. In that case, what do we do? So then we have to rely on the donation. And then how do we pay the donation? This is where donors can come into the system and pay for the somebody can open a for this, they can say this particular transaction is there, we want somebody to donate and this is the donation amount, and everybody can then start putting in the money and it goes into the wallet of the appropriate party. So the donation model is something which can be created around this transaction. The prescription model also can be defined around this transaction. So what is prescription model? It is basically the prescriptions given by the doctors. So here we are generating a one-way data of medical data getting pulled in, but what happens, what is the result of that, what the doctor has prescribed, all this is not captured in the system. It is not part of the this phase. So but there has to be some place to capture these prescriptions, and so this prescription model, the advantage is then somebody, whoever is looking at the medical history, they don't only look at the indicators, they'll also look at the prescribed medicines and what happened through that course of the medical medical you can say the medical period. So for 2 months I was visiting this doctor, the doctor prescribed this, then the doctor prescribed that, then I went to that doctor. So those are also that is also part of a medical history. So here we are just looking at electronic health record, but what happens around that electronic health record is not exactly captured. So that information, I think ideally some kind of a prescription model has to be there around as to who has prescribed what during the course of the medical report itself. So another thing that can be embedded into the system is give points for whoever is using the system. The patient is using the system, give some points or have some NFT. So NFT is just like, as I told you, it is a so the difference between this NFT and points would be, points are just numbers, right? Anybody can manipulate, but NFT is like a record goes in with a particular ID, and that nobody can modify then. It doesn't have a price, but it has a unique ID, it has a unique value, and nobody can modify that. So it is a proof of who owns this NFT in the future. So that is what NFT is. Okay, so it is still, we can generate points and we can make it part of the NFT. So every token we generate will say this is this, and this token is worth 1 point or 2 points, something like that. And so those so we can have a points model or we can have an NFT model surrounded around this transaction to encourage people to use the system, and later somebody we can have an incentive model based on these points, or we can have a reputation model also around so reputation model is like, let's say some doctors are better, some doctors, something is better about them, so we can create a reputation model around to know, okay, which doctors are good. Okay, we can search them out through the blockchain. So apart from medical test indicators, other medical procedures like hospitalization, insurance, operations and other types can be supported around these transactions. Right now we are looking at electronic health record, but what happens if, let's say somebody has got hospitalized after that medical record, or somebody is associated with the insurance, or so there are a lot of things happening around after the health record is taken. So those are also some kind of a report, you can say. The hospitalization happened, this transaction happened, this doctor was involved, and so there are multiple parties involved throughout the medical process, just around one report. And then we are talking about a history of medical data, but we I am also talking about including enabling tracking of the entire medical process involved in each around that medical data. What was hospitalization happening, which insurance company was involved, etc. and etc. So right now, so what is the biggest advantage of doing all this in blockchain? It is a global database. Nobody, and it gets permanent. So nobody can say I didn't take this money, this insurance didn't take this money, this hospital did not hospitalize me, this doctor was not involved. Nobody can defy and say this I was not involved with. It is a global record. You are going on record saying this is what we have done and this is what we have involved. So it is very transparent, it is very permanent, and that is where the benefit of blockchain really becomes alive. And it creates the entire health system is I'm trying to say that the entire health system can be embedded into the blockchain automatically. And so the automation is more the manual process of when you go to a big hospital, you see so many people, it is so much of data has to be collected, so much forms have to be filled in. All these processes, if it is can be automated through a blockchain, which is a global database for anyone and everyone in the world, it will save a lot of time, and it will ease of a lot of it will the medical can easily be reached out to everyone then. So then the other model which can be defined around this transaction is a service payment model. So there are so many people giving services to a particular patient, right? So the nurses are involved, the people in the operation theater, the lead doctor is involved, then the supporting doctors are involved, the supporting people in the operation are involved, in the ICU somebody is helping with the bedding and everything. So one can define that so much is the money for the transaction, and this transaction will be distributed with across different people in different roles with so much of amount. So it is very transparent who's getting what in the system. Sometimes we have a problem like a medical system has taken the money, but there is no record. So this transparency will make sure, and will encourage also, because if everybody knows that, okay, this is what I'm going to get for this particular service. Let's say a nurse knows that I'm going to get 10,000 rupees from this service. It is defined, and the patient pays it. And once he pays it, then once the patient approves, that the patient has got it in his wallet, and once he approves, it is automatically distributed to all the people involved in the system. So that is a service payment model. So that also can be defined around this transaction. So so this is all some of the ideas which had come to my mind today. Any questions, something that you have not understood, whatever I spoke so far?
No, sir.
Okay.
Yeah.
So definitely I'm talking about a exhaustive system, but we're not talking about putting that in the system currently, but but definitely we want to have inside the system, then the value of the system will be more beneficial for everyone. We want to have inclusive, transparent, secure, automated processes in the health system. So what are the constraints? We do not have the funding, right? So if we want to move ahead with this project, we do not know how far we'll take it, but we definitely want to promote the idea to we want to share these ideas with people, especially governments and UN, who would want to take this at the global level and reach out to the to the entire globe. That is what this competition is about, right? Sustainability goals. It is at the global level. So how do we change how medical medical processes work? At a health level, financial level. The other constraint is the technologies are new, so there's a huge learning curve in learning the technologies involved in the system, such as Substrate and 5ire. So hence ideas are taking time to implement. We could not find a proper tutorial code as to how proof of 5ire can be implemented. We wanted to implement it to introduce some incentive scheme mechanisms and other possible models such as pricing. Then what are we covered? Services, then donation, prescription, and what else? Services done. Then points or repetition model. And what else? So token, right? We want to have our own token of crypto.
Yes, sir.
Then species, we want to support different species. So we are a human species, but we want to support everyone, even animals, because they are the people. Animals usually get ignored, you know, as if they don't live. So we want to include them also in this process. And what else? Do you see anything else? Medical procedure, right? In which hospitalization and then etc will come, and insurance. Let me see if I missed anything. Did somebody join in? Okay, so basically, when I was thinking about ideas as to because there is no pricing so far we have discussed, no incentives we have discussed. So these are some of the ideas which keep in my mind. Okay, maybe we can create an entire health system around blockchain, not only health record, and so but in the first phase we can focus on health records. So that is what I'm thinking about the system. So the other two parts are the front end design and the back end design. So this front end design, I want to put Nikita's name. So it says these are the actors involved, and so here you see a kind of a diagram. So a patient is there on the left hand side. He gives a blood sample to the medical center. The medical center produces the results and puts it in the blockchain. Then the blockchain network is accessed from the Swastha app, and the patient can collect his data from the through the Swastha app, which will in turn connect to blockchain network where the results are, and he can see it over here. On the other hand, the patient can visit the physician, and the physician can say, please share me your report, and can send a request, and patient can approve the request through the same app. And the government and researchers are kind of a, they are more of a data they do data analysis and decision process, so government can pull the data for all the patients and all the medical history from this blockchain network if permissions are given by different patients. So every patient will have to give permission as to which countries are allowed to see the data or not allowed to see the data, and even in the same way the permissions have to be given to the researchers. So every time government and researcher is involved, they may be required to make a data request, and if the patient has approved it, then only they can receive it. And it is possible that the patient will set a price for sharing the data, so that the patient also earns in the entire process. That is what that diagram is about. So this diagram is where the patient is opening the app, and it's seeing all the reports that it has received, right? So it has received all these reports from the different medical centers over the period of time, over a period of different time dates. And on the right hand side, if you notice, all the indicators are there, of a one particular report, like hemoglobin, RBC, WC, and then he checks, he or she checks this particular indicators and sends. So whom this data is sent to? This data is sent to the physician who is requesting for the data. It has to be approved and sent by the patient. Only then the physician will see the record. And this we are doing because we want to make sure the data is private to the patient, and unless the patient is given access, the data of the patient should never be shared. And here, if you notice, this is a physician's, is entering into the system, and he is making a request over here. On the right hand side, he is receiving the request, the results of the patient. So that is his main, one of the main things he's doing in the system. So he's and he's prescribing also. So though we don't have a prescription model in integrated into a system, this is one way he can prescribe from here, and that can be recorded in the blockchain. So whatever data we capture in this app, it has to have some place on the blockchain. So that is very important. Okay, we cannot have our own different database and then we are taking care of the database, because nobody is going to do that. We need people who are sponsoring the node. They will take care of the data. So that data can be taken care of only if it is on the blockchain. And the researcher. So this is a researcher. He says, I want to look at particular indicator, the age group, the country for so and so period, and then he gets a report on the right hand side. He can generate a report. He can see some graphs. So all this data he gets, and definitely he'll see the data of only people who has approved. So definitely we want to tell him how many people have approved and how many people have not approved, so that he knows what is the demographic profile. So there were 10 patients, out of which 2 has approved and only 8 has not approved. That means that result is not very good, and at least we want 80% of the people to approve, to share their data. So definitely if the researcher is involved, and some funding will be involved. So whatever funding is involved, that money goes to the patients who share their data. So that way, whatever funding the researcher is getting from the government or from the university, that money has to be, using the pricing model, it has to be distributed to the patients also, for so that they get money for sharing the data. And this is a government level, where the government is also going into the system and saying, I want to check the data for my country. So this is the indicator, this is the age group, what is the result. So they want to check the body mass index, how many people are having good muscle strength, or what is the level of obesity, this kind of problems. And there can be different things that an indicator can tell you. So maybe the government wants to look at those indicators. They want to see the malnutrition. What is how the malnutrition will be tracked. Definitely there will be some indicators that has to show up in the some medical report, and that has to be there as a part of the system, and that is something government can query and come up with the same report, like the researchers, like some graphs or some tool. So that was a front end design. The back end design, again let me. So I start up with the first diagram. This diagram is the same, and then I go on to explain what is happening in this green box, green oval box. So let me make this little big so that you can see. So here if you see the entry point is on here. So if you have a mobile app on the left hand side, it will try to connect to the 5ire and interface, and through the 5ire internally it will connect to the substrate, and substrate contains of all the blocks and palettes. As I told you, palettes are like kind of a external, it enables off-chain programming, right? So so we can have all our programming done in this palette over here. Whatever models I've been talking about, pricing model or medical report, all those programs can be written in a palette over here. And whatever transaction is happening, like let's say somebody is sending a medical report, somebody is paying for the medical report, somebody is getting operated, somebody is insurance person is giving the insurance money. All this has to be captured as transactions, and transactions, every transaction is captured in some block. So every block will have a set of transactions, and every block will be connected to some other block, and that is why it is a chain of blocks, and that's why it's called blockchain. So here I'm explaining the different components. So 5ire is utilized in about design as a front-end interface for all requests, but one can directly connect to Substrate node, which means though we are going through the 5ire, because 5ire have one of the thing is 5ire is directly connected to the sustainability goals, and one can earn money through the 5ire also in case if somebody sponsors, they have a donation mechanism and etc. Then one can earn through that also for contributing towards the sustainability goal. The backend is substrate based blockchain node. So this is the node which you all were trying to create. So this node is where where everything is happening, is the heart of the system, right? So the substrate runtime. So node is like a computer actually. So runtime is the environment, where on which is running on the machine. So node is a machine, which is your laptop or something. Then when you install Substrate and when you're running the node, actually you're running it in a runtime, in a particular part of the memory, and then you have a palette, right? So palettes are basically like your specific programs, that is implementing your application. So palette is like your application program. So here one of the key objects, data object that we're using is the Swastha object over here. So this fields, this is the first draft where we have defined the fields, and we we want to use this, but not necessarily we have to remain to this structure. If we feel something has to be added or removed or modified, we can do that later also. But at a very high level, we want to identify which this particular Swastha object is like, is correlating to a particular medical report or a particular transaction, something that has happened inside the blockchain. We want that information around that. Now what is that information? Definitely we want to know this transaction is part of which block and which transaction ID, and that has to be stored in a DNA. So right now I'm just saying DNA, but we can change the name a little bit. So then price, right? What is the price of that transaction? So ideally we are not talking about gas price, we are talking about the actual transaction price. Like let's say you are the medical center is sending the medical report to somebody, to a patient, then that medical center can charge a particular price. So that price has to be set by the medical center or whoever is involved, the doctor is involved or the hospital is involved. Somebody is going to charge. When the patient is sending the data to government, everybody can as an option to set a price, that if you want this transaction, then this is the price. So this is right now vague. We still need to think about this more. I've not thought so much about it, but definitely I've at least have set a place where in case if we need to set a price, this is the place. So this price may be set by medical center, physicians who creating the report, patients who approves the data request. Price need not necessarily be paid at the time of transaction being uploaded, but may be accepted later as a separate transaction or via donation field. So it is like, let's say doctor is creating a transaction, let's say this operation has to be taken place. So he's setting a price. Now it does not mean that price has to be paid which means the transaction is gone to patient. That's a zero fee transaction, but it has gone with a price value. Now if the patient wants to operate, then let's say patient does not has does not has the money, let's say, then he starts a campaign. So there has to be some option in the system to start a campaign. So what he starts a particular campaign in which everybody contributes towards the wallet, and that wallet can be an escrow wallet, or kind of a middle party wallet, or till the campaign is running. And once the campaign is running over, the patient can approve the movement of that money from that escrow account to the person or the party who has set the price. So I hope you all understood the what I'm saying over here. So we want that kind of facility in the system, because we want it to be automated, we want it to be easy, we want it to be reachable to everyone, we want to be inclusive, to include everyone. So and we want that especially in hospitals, this medical center which is not there in too much numbers, we want to create a system which is global and which is reachable to everyone. Gender is definitely, if the patient is involved and we want to know what is the gender of the person, and here it is not only male and female we are including, we are also including transgender. So this is very important. So the owner of the report, right? So at any given time somebody is owning this report. So when the medical report is generating the report, it is quite possible until the price is paid, the medical center will own the report. But once the patient is paid for that medical report, then the patient owns that report. So this can be very useful in determining making some decisions in our programs. Countries where the report is generated, right? So if we want to know if some government is not allowed to see data of the other country, then this field will tell us which data we can, it will help us filter out the data that can be displayed versus not displayed. Then the age of the species, right? We want to know the age of the species over here. Now here we have not captured the date of birth, but somewhere in the system we definitely at a wallet level or the person's account level, we want to make sure that we know the date of birth or something to calculate the age of the species. But this age of the species is actually indicating the age at the time of medical transaction. Okay, so if I took a medical report in 2022, my age may be 10 years, but if I take the same report in 2024, my age will be 12 years, right? So 2 years more. So the age may vary depending on when I am taking the report. So that has to be recorded. So this Swastha object is like a small database. It has to contain everything around that medical report. Whatever information that is around that medical report, if hospitalization was done, prescription was done, payments was done, health record was was retrieved, whatever operation has happened around that medical transaction, ideally we want it to be recorded in this object. That is what we are trying to do, so that if anybody wants to take a report that I did this medical report and this is all these things happened around this medical report, then we want to have that ability, and that can be done very easily if everything is embedded in this object. We create a JSON data, from the JSON data we create a simple PDF report, and that report the patient takes and he approves it, he sends it to somebody, he can do anything. But he has a record and he can fetch this report anytime from anywhere in the world, till then it is there on the blockchain. So that is the advantage of blockchain, right? Species. So species, there are two fields which is very important. One is a species type and one is a species category. So the species type, as I told you, we want to include birds, animals, fishes and others also, right? So for me, I feel this 4 covers kind of everything: humans, birds, animals, fish, unless we consider something as living like trees and everything, which we are not. But I've given an option for other also, means which is not a human, which is not a bird, which is not an animal, which is not a fish. So then it has to be an alien or something else. Okay. So we now know aliens. We may work with aliens also, and the blockchain system will be not only global, it will be universal. The species type, then in this basically the species category, right? If it is an animal, then we definitely want to know whether it's a dog, cat, rabbit, because these are the very big wider range of animals like anyone in the animal world will be operating on, right? So we want to track that. In the species type is fish, then definitely mostly I've seen that the big fishes are usually tracked like dolphins and sharks, so those things can be also be tracked over here and looked into their health history. Then we definitely want to know the blood group of the species, right? Especially if it is humans. And miscellaneous, this is a variable storage. In the sense, we do not know what we are going to put in. Or it may be something that we have not, known at this stage. And tomorrow we forgot to put some. We wanted to have some place to put the data, some extra data into the blockchain about something which we did not realize in the beginning. We didn't create a field for it. But this is a place which we want to enable putting extra data, so that whoever is creating a system around Swastha, they can take the data and put it over here. Maybe some extra data is required about a fish, about a particular shark. That data can be put in over here. A link maybe, or a price, something, whatever, there's like a storage, extra storage. Medical procedure, right? So here we want to cover we are thinking about electronic health record, right? So but medical procedure can be a medical test, body mass index, surgery, can be anything. So those kind of so though we are not implementing this model into a system, we are definitely having a place, a field defined to cover this part. Okay. So your medical report, this is the main piece that we are working on. So this is basically a structure containing indicators, as I told you, and what is the unit of that indicator, what is the value of that indicator. So you can say your blood pressure rate is the indicator is blood pressure rate, unit is 20, and so what you're trying to say 20 or whatever, 20 heartbeats per second, something, that is your unit, and the value will be 20. Then, as I told you, the donation model we want to integrate into the system. So this is a place which I have put in to integrate donations. So it represents the donation details, such as the donation amount desired, donation escrow wallet connected to this system, wallets that will be paid, the donation. So we want to know anytime there is a donation happening, there are a lot of people involved, so we want to capture this entire thing in a structure within this donation object. Okay, just like Swastha is an object, within Swastha there is a donation object also, and donation object, if you open up, there will be more fields in this. So it is not like a simple string value or something. It is a definitely a thought over data structure. So something which we have not decided, but definitely some of the fields have given an indication what are the structure of a donation will contain. It will contain the amount that is desired, the escrow wallet that will receive the money, the wallet that will be paid the donation. So we definitely want to have all this information in the donation structure. In the same way, if we want to include a points and NFTs, then this is the field which we are going to use. So definitely we have not defined the point structure. It is not a simple string or integer. It is a kind of a proper class object. So it is a data within a data, So then the same way we have a place for prescription model, where all the prescriptions around the medical report is tracked. So that is a prescription field. Then associated transactions. Now what can happen is my medical center, like over the period of just only generating a report, a lot of things can happen, right? A medical center creates a report, that is one transaction. Patient sends a report to physician, second transaction. Physician prescribes a patient for an operation, third transaction. How do you know which transactions were involved around a particular medical report? So this is a set of associated transaction, is a set of all the transactions tracked over here in that particular order, so that if I get this Swastha object, I also have the tran IDs over here, the sequence of the tran IDs, what happened, what after what, so it is a kind of a medical sequence of events around a particular report. And then we have an insurance object to make sure. So what all will cover in insurance object? Will have an insurance company that is involved, insurance payment that is charged, on insurance money that is received. So this is becoming more transparent. So no longer anyone can say insurance company, we want to know which insurance company has paid. The government wants to know how many insurance companies have paid how much of money to the patient, how much has the patient requested. How do you get that information? Today it's very difficult because insurance, there are so many insurance companies. It is not a transparent system, and there is definitely a chance of abuse also, right? In this, somebody is not paying up, you pay the premiums and everything, but it is not paid up, etc, etc, etc. So if we can include medical insurance as a part of the system, it is more transparent, anybody can see it and nobody can change it. That is the main purpose of the blockchain, right? Nobody can change it once that record is gone into the system. Authorized wallet ID. So this is a wallet ID of a person. Either it is either the wallet ID, it may be a guardian or a parent, right, related to the patient who is approving the payments. So maybe the patient cannot approve the payment, but he is authorizing another wallet ID of somebody who will authorize the payment. So let's say the donation money was collected has to be given to the doctor, so that wallet ID has to be mentioned over here. So mostly it will be the patient itself who will authorize it in case if he's doing everything on his own. But usually we see around the patient the people, and then definitely one key wallet ID has to be connected, who's the main approver of the money transaction coming from or to the patient. Then associated wallets. So when we say wallets, it is basically account IDs, you can say, or we can say accounts that are related or to people who are involved in the system. Okay, that is what it means. So this so the associated wallets means this represents wallet IDs of all the people and authorities involved around a transaction and roles that are specifically played in this transaction. So let's say person A was a lead doctor, but we have to now, why the role is important? Because a doctor can be a patient also, no? So tomorrow that person E can play the role of a patient, so not necessary. So one person can have multiple roles. So definitely when we are talking about a particular medical transaction, we not only have to know the person, but what role he was playing in this entire process. So that's why both the things have to be captured, and that is what associated wallets have to be captured, and the roles that they played has to be captured. So it has to be some kind of a data structure which captures both the information. So person B may be doing the operation service, patient C may be the patient who got operated, person D may be the donor who gave the blood, the person E may be the donor who sponsored the operation, right? So we want to know every person who was involved around a medical transaction, and this kind of data is very useful, right? If it is transparent, it is secure, it is useful, it is, you can this can even help you not only know your medical history, but also can be used by legal system, right, to see okay what happened in the system. This was the data. It can be in case there is any problem, the records are here to reflect the same. So Swastha data structure, the one which we saw above, it is a key object inside the system. It represents the detail pertaining to the medical report as described above. Substrate runtime enables the data to be stored off-chain and also enables encryption, feeless, token, forkless upgrades. So what is forkless upgrades means? Basically anytime you want to change the code, you can change the code without disturbing the blockchain. The blockchain will have all the IDs, but the main magic will be happening in the palettes. So you can change the palette as and when required without touching the blockchain main chain. So that is what that happens because it is off chain, and it is the off chain is tightly integrated with the on chain also at the same time. So that is a benefit of Substrate, using Substrate. So some fields defined in the above Swastha data structure will be another data structure, means it is data within the data, right? So it is a system within a system. So it is an application within an application. So in health we have pricing, we have donation, we have insurance, we have hospitalization, so many things are there. So everything has a system. So we are creating a full-on health system, but we're not, in this phase we are not thinking of focusing on that part, but we definitely have a place in a data structure to accommodate that. I have thought about that and I have put in over there. So definitely we have that piece in place, and we are trying to give a kind of a guide to whoever is extending this system. This is how it can be extended. So these are the extra things like donation, medical report, miscellaneous, price, points, description, associated wallets, associated transaction. So some fields will need enumeration data structure. Enumeration data structure are like is giving a numbering. For example, blood pressure means 1, WBC means 2, RBC means 3. So this is one enumeration, but there are many enumerations have to be defined for everything. We have to define enumeration for every unit. Now, right now, what I gave you was an enumeration of indicators, but yeah, there can be enumeration of units also. No, units can be kilogram, can be just a simple count, can be number of heartbeats per second. So those can be the units. So the unit will have its own enumeration. So we cannot put simple text. We cannot type text and say this is milligram. That is erroneous. So we have to give some number to it, some ID to it. So we can say milligram means 1. Number of heartbeats per second is 2. So that way when we say 1, we understand what unit we are talking about and what indicator we are talking about. In the medical procedure, we have we definitely we want to know whether this is a medical report we are dealing with, whether this is an operation we are dealing with, whether this is a insurance we are dealing with, whether this is a donation we are dealing with. What are we dealing with? So that is a procedure. It has to be enumerated so that we know, okay, if 1 it means this, if 2 it means this. Definitely then species has to be enumerated, country has to be enumerated, gender has to be enumerated, right? So in the same way, a lot of things maybe have to be enumerated. Then every wallet should have the counts. Some counts that we want is total points gathered by that wallet. Every patient, because that patient or the doctor is using the system, some points are generated. I mentioned that we are generating points or cryptos or tokens, something. So that it goes in the system. We may not have any payment associated with it, but tomorrow maybe that value it can become a valuable asset. Then every wallet should also have the link to complete history of transaction. So particular patient, definitely they want to know the history of transaction, that it should be fetchable and available in a easier manner, in a faster manner, in a secure manner. So the patient should be able to download, share, disable, enable the data. So we have to give more power to the patient, and we have to enable the patient to pay for his services. That is where the system will become alive, right? If we connect the patient system to the donation, so for example, in a donation, I'm thinking about this system where let's say one person sends tell 3 people to give 10 rupees. And then those three people ask another 3 people to give 10 rupees. Now 10 rupees is a very small amount, but when you take it to a depth of 10 levels, the level 1 is, the first level is me, and then I give it to another 3 people, that is level 2. Those 3 people tell another 3 people to pay, that is level 2, and at level 10 this amount will be 4 to 5 lakhs, or you will say 5 lakhs. So you can quickly collect a big amount of money through this kind of model. So that is an idea which I have I want to integrate into the system if it is possible. But I hope you all understood the way donation model I wanted to use. So this kind of donation which is very less, like 10 rupees, anybody will pay, and if it is very easy, they'll anyway pay. So every time they pay, somebody gives a donation, we can give them some points. So those are the incentives we can create around in the system. So the main function of the palette, some of the main function will be, there should be a function to create a medical report, get medical report, query medical report. These are the 3 main functions, because we are supporting only medical reports right now. We're not supporting insurance, we're not supporting donations, we're not supporting hospitalizations, nothing. If those functions are implemented, then definitely this functionality has to be extended and designed more further. Then 5ire is a main interface, so in the 5ire, one should be able to create an account, one should be able to make a medical request. Definitely when you are creating a medical data request over here, that call ultimately goes to the palette, right? The palette has to in the palette there is a function called create medical report. So there is a this is a palette function and the 5ire function. So there has to be some connection from the 5ire either towards the on-chain or to the off-chain. If it is off-chain, then palette. If it is on-chain, then definitely the blockchain, right? So for creating account, definitely it is connected to the blockchain. creating a medical request, then definitely it's connected to the off chain. So most of the stuff is connected to the off chain. So we are keeping things off chain because we want to keep system feeless, without any fees. If it goes on the blockchain, there is a gas price involved and everything. So we have not worked out the exact how this exactly will work out or more details, but definitely we want to keep it cost free, or at least less cost involved in for anybody to bring up the system or use the system. So that was the backend, and so that is all to the proposal design, which a lot of things were new in today whatever I've shared, because I've been just thinking about what to do, and this is a design phase, so we share our idea and then we see how this moves forward. Any questions?
No, sir. So will you be sharing this doc in the group, the document?